Hello, and welcome to this training session on oral nutritional supplements replacement in care homes. This workstream focuses on replacing prescribed oral nutritional supplements, commonly known as ONS, with homemade supplements in care homes across LLR. We fully appreciate that this represents a significant change in practice, and we want to reassure you that we are here to support you every step of the way. Our team will be available to provide guidance, answer questions, and offer practical help during this transition to ensure this is as smooth as possible for you and your respective care homes. Our goal is to give you a clear overview of the new LLR care home malnutrition management pathway and how it can be applied in everyday practice. By the end of this session, you will understand how to manage residents based on their must scores, be able to identify exclusion criteria, and know when to seek further advice. Know what support is available, including referral routes, and finally, know where to find key resources and documentation to help you implement this effectively. This slide is simply a recap of why this initiative matters and the key benefits it brings. It's important to remind ourselves that the benefits go beyond financial savings for the NHS. The real impact is on patients, the residents, their health, well-being, and quality of life. And also, this approach improves patient compliance and supports a more sustainable, inclusive way of working.
This is a slide showing the care home malnutrition management pathway, which we will talk through today to guide you on how to support patients who have been identified at high risk of malnutrition. The MUST tool is a malnutrition universal screening tool, which you may be familiar with, which has been designed to identify adults who are malnourished or at risk of malnutrition. We will talk you through what steps you need to take once you have completed a MUST assessment, and what actions you will take as part of the nutrition care plan for your residents in order to support them in ensuring adequate nutrition and hydration. We'll be highlighting a number of key documents that will help you in your assessment and help you in providing support for patients, and also identifying where patients may not be suitable to follow this guidance and where advice or referral to a dietitian is required. I'll now be moving on to the next slide.
So here we have an example of a patient or a resident that you may have in your home. And we'll use example of Ethel, who appears in our ICANN training, which is the Improving Community Adult Nutrition Training, which is available on the Leicestershire Nutrition and Dietetics website. And this covers how to calculate MUST scores and how to create care plans. In this example, Ethel, a 79-year-old care home resident, is active around the home and enjoys her meals. She's usually finishing all of them. Her current weight is 60 kilos. Her weight 3 months ago was 63 kilos. Her height has been measured at 1.52 metres, giving her BMI of 25.96. This places her in the overweight category in regards to her BMI. She's experienced a 7.4 unintentional weight loss in the last 3 months. As this is below 5%, her current MUST score is 0. So working through the pathway, the first question asks if your resident has a high nutritional need due to a pressure ulcer or similar condition, which we know she does not. She's not at risk of malnutrition and no treatment is required, so the care plan is updated. And MUST screening occurs every month or for more frequently than that if there's concerns. If in this instance Ethel did have a pressure ulcer, she would then be treated as medium in terms of a risk of malnutrition. And we'll move on to what a medium risk looks like otherwise. Medium risk is a score of 1. Ethel has a chest infection. She's now eating less of her meals, about 3/4 of them, and it's only having 1 pudding a day. Her weight is checked and she's lost a further 2 kilos of weight and now at 58 kilos. Her BMI is 25.1, which places her at the upper end of the healthy range. and her unintentional weight loss over the last 3 months now amounts to 7.9%. This is between 5 and 10% weight loss, therefore her MUST score equals 1. Ethel is identified at medium risk of malnutrition, and a nutritional care plan needs updating accordingly. The pathway indicates that we need to aim to increase her intake by 500 calories using food-based treatments, and this is a separate document that can be found on the Providing Care website. And on here, it gives details in terms of how foods can be fortified and what snacks can be fortified, with details of the calories and the protein within these snacks and fortifications to help support 500 additional calories in her diet. MUST screening then occurs every month or earlier if there are concerns. If there's evidence after 1 month of improvement, the plan would continue until she's reached her treatment goal. If it doesn't, we then move on to treating her as high risk. High risk is a MUST score of 2. We can see now that Ethel has deteriorated further, and she's now on antibiotics for her chest infection. She's getting some side effects from the antibiotics, which has meant she's now experienced further weight loss, and her weight is 56 kilos. She's lost a further 2 kilos of weight. Her BMI is 24.2, which places her in the healthy range. Her unintentional weight loss has now risen to 11.1%, a total of 7 kilos in total. And as this is above 10% weight loss, she scores a MUST of 2 for her unintentional weight loss. Looking at the pathway, we are now treating her as high risk of malnutrition, and her nutritional care plan is updated accordingly. She will continue to have her additional 500 calories from food-based treatments, and carers would be directed towards the exclusion criteria. The exclusion criteria will cover us shortly, and this provides details of when people may move away from this pathway and need further care from other places. In this example, we can see that Ethel doesn't meet any of the exclusion criteria, so we move on to, in addition to the 500 calories of snacks and food fortification, having 2 portions per day from one of the homemade supplement drinks in the recipes provided. We'll go into more detail about these later on in the presentation. Again, screening for MUST is repeated every month or earlier if there are any more concerns. And if she continues to gain weight, then we would continue with the treatment until the treatment goal is reached. However, if you think there are any other further concerns, or if she meets any of the exclusion criteria, you can then seek support from a dietitian.
So on this slide here, we are showing you the clinical exclusion criteria, which highlights patients who would not be suitable to follow the scheme. And this would be a step that you follow before considering the homemade replacement drinks. There are some very clear exclusion criteria, which include patients who are tube fed. Residents would usually be under our Leicestershire Nutrition and Dietetics home enteral tube feeding dietetic team, but our resources provide details to contact the team if you had any queries. Another group of patients or residents who would be excluded include those who have been diagnosed with a swallowing difficulty, dysphagia, and require thickened oral nutritional supplements, and who have been identified as malnourished using the MUST screening tool. There is guidance within our resources on making a direct referral to dietetics for these residents, and guidance for GPs on pre-thickened oral nutritional supplements that can be prescribed where there is an urgent need whilst awaiting dietetic input. The last exception would be in very exceptional circumstances where a clinical assessment indicates the need to consider an alternative intervention to a food-based approach, which will be decided on a case-by-case basis, and a clear justification and rationale must be provided as to why this would be required. On the next slide, we'll be sharing some further guidance to help identify where there might be further exceptional circumstances or where further guidance from a dietitian is required before commencing homemade supplement drinks. We have listed within this section some clinical conditions or considerations Now, this doesn't mean that all of the patients that have these clinical conditions would automatically require prescribed oral nutritional supplements. It may simply mean that tailored advice may be required on their nutritional care plan to tailor food-based treatment in supporting that patient to meet their specific needs. And a referral to a dietitian can support with this. On the next slide, we've also included some further guidance on elements of the patient's background or presentation where there is some first line advice or steps to consider, which don't necessarily require a referral to a dietitian, but there may be reasonable adjustments or steps that you can put in place immediately to support a patient with their care. If there are any elements where you are unsure, we will cover within our support section on how to contact a dietitian via our dedicated inbox. I'll now move on to the next slide.
So here we have provided some details of the homemade supplement drinks and the recipes that will be available that will substitute the current prescribed oral nutritional drinks within the home. These drinks have a nutritional breakdown, which you can see in the bottom right-hand corner, which shows that they have a similar nutrition that would normally be provided by the prescribed oral nutritional drinks. So from these supplements, there will be the similar nutrients going in being provided. As you can see, there are a range of drinks, and here are some of our milk-based drinks and the vegan milkshake alternative. Full details of these recipes will also be provided within the resources. It's important to highlight here that within these recipes, a number of ingredients are provided, and this is to ensure that care homes can access the ingredients needed in order to make these drinks up. It's vitally important that these recipes are stuck to in regards to the quantities that are provided and also the types of ingredients that are provided, as it's because of these quantities and the ingredients that are shown that mean that we can provide a similar nutrition to our prescribed oral nutritional drinks. This is how we hope that this scheme is going to improve quality of life and inclusivity, as we have the vegan alternative as well as the milk-based drinks. And you can see that we also have a hot chocolate recipe and an Ovaltine recipe that can be provided at drinks rounds. In addition to our milk-based drinks, we also have a juice-style drink. And again, a nutritional breakdown for this is provided at the bottom, which evidence that these provide similar amount of nutrition to the prescribed alternatives. Again, a number of ingredients are provided here, and you'll notice that these are multivitamin juices, and this is to help ensure that the fruit juices are providing the vitamins and minerals that's required, as well as the energy and protein from the egg powder, that it would be similar to the prescribed alternatives. Now I'll move on to a couple of videos to show you how to make these milkshakes up.
This is how to make a fortified milkshake. First, you need 2 generous tablespoons of skimmed milk powder. And then you need 4 heaped teaspoons of a vitamin fortified milkshake powder. And then you need 180 ml of full fat milk. and gradually add this in. And now enjoy. This is how to make a fortified fruit juice drink. First, you take 10 grams of egg white powder and put those in the glass. Then you need 40 ml of an undiluted premium cordial. Add this gradually . Then you need 180 ml of a vitamin fortified pure fruit juice. Gradually add this in as well. And now enjoy.
So as you can see here, there are video links for all of the 5 drink recipes that we have provided. Some tips for when you're making up the homemade supplement drinks. These homemade supplement drinks can be made up in batches of multiple portions, but please do consider your patient's preferences. That it's important that they get a type and a flavour of drink that they are going to enjoy to help with compliance. Homemade drinks can be stored up in the fridge for up to 24 hours and outside of the fridge for 4 hours as per Food Standards Agency guidelines. However, after these time periods, please discard whatever is left over. It's important that you only use the ingredients as listed, as this ensures they're providing the correct nutrition to the resident. And if your resident is unable to consume the homemade supplements or experiences any other problems, we have a range of resources that you can use in regard on the Providing Care website, and you can contact our dietetics department for further support. Remember that these homemade supplements are only intended for residents at high risk of malnutrition with a MUST score of 2 or above, who would have previously been prescribed an oral nutritional supplement drink, and these are not the same as fortified milkshakes that you may have been advised to provide residents in the past or that appear on the food-based treatment resource sheet.
So we're now going to talk you through when to make a referral to a dietitian and when you may require further advice. If you have been following the pathway up to this point and identified that your resident is at high risk of malnutrition, there are a number of steps here for you to check to ensure that all required stages have been carried out in supporting your resident as best as possible to provide adequate nutrition and hydration. So you'd want to make sure that food-based treatment has been provided every day for at least 1 month. This includes fortifying foods, and the hyperlinks will take you to resources to provide further guidance. as well as ensuring that your resident has been provided with homemade replacement drinks prepared exactly as per the recipe. If all of these steps have been taken and you are still concerned about your resident, there's been further weight loss, or you're still unsure, then it may be time to consider a referral to the dietitian. If referral criteria hasn't been met and you are still wanting to speak to a dietitian, please email us via the inbox that is on the slide, and we will provide you with appropriate guidance or signposting. If it is clear that referral criteria has been met, please complete a care home to dietetics direct referral form, which we will show you on the screen. This must be sent with 3 days of detailed food and fluid record charts, as well as a copy of the residence mass charts, in order for a full assessment to be considered. It's worth highlighting that any incomplete forms will be sent back. So I will now talk you through the care home to dietetics referral form, which again highlights the importance of sending the mass charts as well as detailed food and fluid charts, and for all questions on the form to be answered. If you have any queries with the form or you're not sure, you can email us via the inbox that has been set up to support you, and ensure that you have included as much information as is requested on the form. I'll now move on to the next slide. So just to summarise the key changes that will be effective from the 1st of September 2025 in the LLR care home malnutrition management pathway, any new care home residents and existing residents who are not on prescribed oral nutritional supplements will be assessed for malnutrition using this pathway going forward, and to follow the appropriate management plans as per the pathway, excluding any residents being admitted from the acute or community hospital discharges. There will be a separate process to follow. Any care home residents already on prescribed oral nutritional supplements and under the care of a community dietitian to continue with their prescribed ONS until the dietitian has their scheduled review and will provide further guidance on whether it's appropriate to switch over. Any existing patients who are already on oral nutritional supplements but not under the care of a community dietitian can be referred via our care home to dietetics direct referral form. If there is any criteria where we feel it is inappropriate for a referral, we will provide you with some guidance and signposting to advise otherwise. And lastly, any acute or community hospital discharge patients will have a process ironed out at a later date as part of a phased launch. Therefore, if a patient comes out of hospital with TTOs, these are to be prescribed and taken until further notice. And if there is a further request for an ongoing prescription, then the resident's GP will review and prescribe if appropriate as per current practice. So we'll now be moving on to the next slide. These are just a number of dates where we are going to be attending to provide further information on the LLR care home malnutrition management pathway, and additional refresher training sessions are in the process of being organised. Therefore, there will be opportunities for you to attend in order to get more information, to answer questions, and also Q&A sessions have been arranged where you have the option to drop in and ask any questions that you require, and all the links will be shared as well.
Resources, including the pathway and recipe guides, will be available on the APC website and the Providing Care website. The ICANN training, Improving Community Adult Nutrition Training, is available on the Leicestershire Nutrition and Dietetics website, and this is for guidance on how to complete MUST screening. And we still also have our Managing Adults Malnutrition in Primary Care guidelines for any patients who still require prescribed oral nutritional supplements in exceptional circumstances. We also have our details below of how you can contact the dietetics department via our email address and our telephone numbers. Evaluation forms will be available for staff to complete, and we highly encourage that you complete these forms so that we can gather information on how we can best support you. We're also going to be providing evaluation forms for residents and family members too, as we would greatly appreciate any feedback they can provide on the new scheme, and again, provide any additional support to individuals and to care homes. Thank you very much for your time today, and there will be Q&A sessions available for you to attend after you've completed this webinar.